Surrogacy options. Is embryo transfer always used? When exploring surrogacy options, many people wonder if embryo transfer is always part of the process. The answer is that in most cases, yes, embryo transfer is a key step, especially in gestational surrogacy. This is because gestational surrogacy relies on in vitro fertilization, or IVF, to create embryos outside the body. These embryos are then transferred into the surrogate's uterus to establish pregnancy. The surrogate does not contribute genetically to the child. Her role is to carry the pregnancy for the intended parents. The process begins with IVF, where eggs from the intended mother or a donor are fertilized with sperm from the intended father or a donor in a laboratory setting. Once viable embryos are formed, they are carefully selected for transfer. Before the transfer, the surrogate's uterus is prepared with hormone treatments, typically estrogen and progesterone, to thicken the uterine lining and make it receptive to implantation. The actual embryo transfer involves placing the embryo into the uterus using a thin catheter guided by ultrasound. The surrogate continues hormone support until pregnancy is confirmed and maintained. There are no alternative surrogacy methods that bypass embryo transfer because pregnancy depends on the embryo implanting in the surrogate's uterus. Traditional surrogacy, which involves inseminating the surrogate with sperm so she is genetically related to the child, does not use embryo transfer. Instead, it involves artificial insemination, which is a different process and less common today. In cases where fertility challenges or conditions like severe endometriosis affect the uterus, embryo transfer through surrogacy can be a vital option. Endometriosis can damage or impair the uterine environment, making carrying a pregnancy difficult or risky. Using a healthy surrogate with a normal uterus and transferring embryos created via IVF allows intended parents to have a biological connection to their child while avoiding pregnancy complications related to endometriosis. In summary, embryo transfer is an essential part of gestational surrogacy and is used in almost all cases. Since the surrogate's pregnancy depends on the implantation of embryos created outside her body, there are no surrogacy options that do not involve embryo transfer. This approach offers a reliable and scientifically supported path to parenthood for many individuals facing fertility issues, including those with uterine conditions like endometriosis. Always consult with fertility specialists or reproductive health professionals to understand the best options for individual circumstances.